The world of medicine doesn't stand still. From changing laws to new ways of running a practice to the growing challenges of delivering care, there's always something new on the horizon. Welcome to On Call with MSMA. Each episode, Mississippi physicians share insights on the business of medicine and the outside forces shaping how it's practiced. From marketing and management to taxes, technology, and patient access, we're covering it all. Because staying informed means staying ahead. And together, we're building a stronger voice for Mississippi medicine. This is On Call with MSMA.
Cool.
Awesome. Well, we'll go ahead and get started. Dr. Craig Moffett here. I'm a District 3 Board Trustee to Mississippi State Medical Association, involved in several committees and advocacy organizations for the Mississippi State Medical Association. And we're trying to bring with these podcasts excellent information to Mississippi physicians so that they can practice to the fullest extent of their ability and advocate for physicians, whether it be with insurance or so that they can practice the way they want and treat patients the best that they can. And to that regard today, we have some excellent guests that are going to be coming online with us today from Callagy Recovery. And in particular, we're going to be discussing a lot of the No Surprise Act that was passed a few years ago, and I'll let them get more into that. But I know that all the physicians, every single day you hear about these record-setting profits insurance companies are having, whether it be, we're not going to name them today, but you all know the names, and you know that they're making billions of dollars a year. And it seems that kind of the people left in the middle there are the individual patients who either need procedures done or want to see their physician, or the physician who maybe does that care but then is not reimbursed for the care they provide for that patient. So as we go today, I know that our two guests here are going to help us expand upon the No Surprise Act, help us understand how patients can be treated and physicians can be reimbursed for that treatment that they give to patients. So we have two phenomenal guests with us today. We have Fernando Valencia, and we also have Dr. Brian Hart. So Fernando is the Chief Revenue Officer, and Dr. Hart is the
plan.
Yes, the man with the plan. So
all good, man.
He does a lot. Well, I'll go ahead and I'm going to mostly let them introduce themselves. I have been able to talk to both of them. Excellent individuals. I know Dr. Hart has medical experience himself, so he's done a lot of different things. But Fernando, I know you do a lot of different roles with many various organizations. So as you're introducing yourself, would you kind of mind expanding upon the many different roles and entities that you work with and kind of how that relates to Callagy Recovery?
Yeah, absolutely. Dr. Moffett, thank you. And the Mississippi Medical Association, none of this would happen without Natalie, Dr. Claude Brunson, and of course, Candace Williams and the legendary Dr. Brian Hart. When I'm not carrying coffee for Candace Williams and when I'm not opening the doors for Dr. Hart, those are my full-time careers. What I do as a side hustle is, yes, I represent multiple different enterprises. And I always get the question, Dr. Moffett, why is Callagy Recovery in the back? Why do I have Unblinded and ACTI? What is Integris Financial? How does it all interconnect? And this will be the easiest and most concise way to answer the story. One, they're not disconnected enterprises, they're one enterprise. So our founder of all of these companies is Sean Callagy. In December, Sean Callagy will be the first human in the history of humanity to be the first blind, self-funded unicorn founder in the world. And he is my co-founder here in Unblinded just as recently. Today is now Tuesday. Last Friday, Sean Callagy and Unblinded became #1 in Apple Podcasts in the business category, number 7th overall in the world. And then in Fun Energy, actually December 19th, Sean has individually pledged to break the Guinness World Book of Record for the world's largest toy drive. He will be buying 119,000 toys. And I'm looking forward to including Mississippi and a variety of our other friends into that. And our last podcast was with Gary Vaynerchuk, and today we released Charlie Sheen. So how does all of that have to do, and how does that interconnect with Callagy Recovery? So Sean Callagy is the visionary, right? My name's Fernando Valencia, and I co-founded Unblinded with Sean. He's my co-founder. Sean founded Callagy Law, which is a law firm 28 years ago. He also founded Callagy Recovery in 2022. We co-founded Unblinded. We also own Integris Financial and ACTI. How does this all interconnect? So think of Unblinded as the marketing and sales engine for the entire enterprise. We are not outsourced. We're not an outside entity. We are our own, LLC. We're our own enterprise, but we're one interconnected system. Callagy Law is a law firm. Callagy Recovery, which is what we're going to focus on today, is responsible for the Arbitration No Surprises Act. Unblinded is a coaching, training, consulting company. We work with lawyers, accountants, wealth advisors, and the medical community. Integris Financial, we do wealth management, risk management, and accounting services. And ACTI, believe it or not, Dr. Moffett, we believe that ACTI, what Microsoft was to IBM and became the operating system of all computers, we believe ACTI is going to be the operating system for all of artificial intelligence. So Unblinded is responsible for the building of the relationships for the entire enterprise. And then depending on which other enterprise could support them, we bring them into the different enterprises. So Unblinded builds the relationships and all the other companies actualize the relationships. That's kind of how we all interconnect together. Oh, I think you're muted.
No, I was just saying, excellent. Thank you so much. And then in particular, the Callagy Recovery, real quick. So what, before we get Dr. Hart in here, what do you do with Callagy Recovery? Kind of what's your main, is it marketing? Is it leadership, revenue officer?
Yeah, so I get called many things, just I hope I never get called late for dinner. So my official title is Director of Actualizer Success. Some call me Chief Growth Officer, some call me Chief Revenue Officer, some call me Chief Partnership Officer. I don't know what any of those mean, Dr. Moffett, but I will tell you that I am responsible for growth. I've been co-leading the initiative of last December. We were recovering $20 million a month for our medical clients. Last month, we recovered $75.3 million for our medical clients. We're pacing $2 million per day. And I've grown our sales team from 2 to 187. And I had the idea in February of building relationships with associations. And after a lot of rejection, a lot of bumping heads with my good friend, Dr. Hart, should we keep doing this? Is this ever going to work? Thank you, Dr. Claude Brunson, for being the first answer in creating this relationship. And since then, we're now working with Alaska, Alabama, New Jersey, New York, and about 24 others are currently in board approval or legal review, so we could be their official arbitration partner. So I'm responsible for growth and expansion and relationships, Dr. Moffett.
That's awesome. I feel like it's easy to grow because, like I said in that kind of opening scene, you know, it's so difficult to get reimbursed in the medical profession. I mean, and when doctors, you know, are not purely altruistic always, but most of us went in because we want to help people. So if we're a surgeon on call, we're going to do the surgery, we're going to do whatever it is and worry about payment later. But it becomes difficult for us to survive sometimes if we're not getting reimbursed so that we can keep helping people, especially in underserved Mississippi where we don't have a law specialist. So I think it's amazing that you're growing this and you're going to help more and more physicians and organizations. We'll go ahead and let Dr. Hart introduce himself if that's okay.
Please, Dr. Hart, over to you.
Dr. Moffett, Fernando, as always, a pleasure to be here. Pleasure to be here with the state of Mississippi and beyond. It's been quite a journey over the last 6 to 9 months, and kudos to Candace and her team with all support over that time frame. And we have definitely learned a lot about how to support associations, what matters to you as associations, the members, the association itself. And we're very clear that the product that we have to deliver with the No Surprise Bill Act and Callagy Recovery has the ability to provide meaningful impact for the state physicians, but they first have to know what it is. So today, that's something we definitely want to uncover, and I'm here to support this association, all the other state associations that we work with, and happy to do so. I do know what it is like to be a healthcare provider and to feel the pain of insurance carriers, what they do. My partners and I still have over $100 million of accounts receivable with carriers like the ones you're mentioning, Dr. Moffett, that we will not name, while still serving 155,000 patients plus a year. It's an asymmetric risk for the carriers versus us, the healthcare providers. And part of my life's journey and vision is to help be the cause of change of this. And happy to be here to support Mississippi and anyone else we can support.
Well, this is excellent. And like I said, I can't wait to get into the kind of the meat and potatoes, as we say here in Mississippi, of this discussion here. And you just brought that up. So if we can go ahead and get into it, you know, physicians and healthcare leaders, you know, we're so busy. A lot of us are working 60, 70, 80 hours a week just trying to take care of our patients. And we know the No Surprise Act passed a few years ago. I think it was 22. You can correct me. We've kind of heard a little bit about it. But can you kind of, just in general, kind of a brief synopsis of that? And then, like, what are some myths about it, or kind of what does that mean to us physicians in Mississippi?
Yeah, Dr. Moffett, I would love to. And typically what everyone wants to know is, What is the No Surprises Act? Who are we and why should you care? How does the whole business model work? And what's the economic impact for the actual end user, the medical provider? So I will answer your question, Dr. Moffett. So the law actually got passed in 2020. It got enacted, as in like held to law, in 2022. And the truth is, Dr. Moffett, here's the misconception, is that it was horrible when it started. I mean, conceptually, it was designed to do well. And the actual reason it was created was not to benefit the medical community. It was created to protect the American people from going into a hospital and having out-of-network benefits and be hit with a surprise bill. So that was the actual intention. A sub-intention that we have beautifully looked at and integrally leveraged was the creation of the federal IDR, short for Federal Independent Dispute Resolution System, which is what we use to arbitrate against carriers for the medical community. So in 2022, it was just not good. It wasn't economically friendly. It was triple the cost to get into it. We had to do individual CPT codes, not like a whole batch thing together. I mean, it just was not a friendly environment for the medical community. And what happened is a gentleman that we know, Dr. Thomas Lee, who I'll share a bit later, he is the current executive director of the Medical Society of New York, went to Texas and caused the Texas Medical Association to actually file a lawsuit against CMS for the interpretation of the No Surprises Act. Those are known as TMA 1, 2, 3, 4, and 5. Those were the jury verdicts. And what that did, Dr. Moffett and everyone listening, is that it interpreted the No Surprises Act to be so much more economically friendly and feasible to the medical community. So what happened, everyone, is that for the first, call it 3 years, 2020 to 2023, the No Surprises Act got a bad reputation. It's not good. It's too complicated. It's not worth it. It's not economically friendly. And that couldn't be any further from the truth. As I mentioned, 75.3 million for our medical providers. That is not a bag of old donuts and stale peanuts. That is significant income for the community. And in 2024, Dr. Moffett, we averaged, to the average surgeon, we averaged $127,000 a month in additional revenue and recovery. That's 1.5 million a year. And the numbers are only better in 2025. And once we finish, as we're in November, we're going to redo that analysis to update the numbers. So those are some of the things I'd love the world to know about the No Surprises Act, is that it started unfriendly and now it's incredibly friendly. But please, back to you.
I just want to kind of highlight, I mean, we just said average surgeon, 1.5 million in additional, well, not additional reimbursement. They deserved it, but reimbursed back to them per year for the average surgeon is what y'all average, correct?
1.5 million for the average surgeon. And we define average as 6 to 7 surgeries that fit what makes something eligible for the No Surprises Act, 6 to 7. So this isn't a hyperbolized, like, hey, let me give you the best case scenario to sound good. This is average. And as you know, Dr. Moffett, and the medical community listening, 6 to 7 surgeries isn't, I'm not saying it's a little, but it's not a lot. It's an average number. Ortho, neuro, spine, plastic, all the other surgeons combined from neuro to anesthesia, the average was $127,000 per month, which was 1.5 million per year.
Thank you. I just wanted to highlight that. In Mississippi, as I've said, we're in underserved states. A lot of times we only have a couple of neurosurgeons, maybe 4 orthopedic surgeons in an area. So, I mean, their caseloads are probably potentially double whatever you're discussing here. So, I mean, I'm not promising they're going to get double that amount, but I think it's going to be very important for them. So kind of on that, though, I mean, these numbers sound great. It sounds a little bit confusing, but on the not being economical part, so why don't y'all explain to me a little bit what your company is able to do? Because we all know that doctors' offices, I mean, you're having to hire 3 people that you pay full-time salaries to try and go out to insurance companies and get money. Mm-hmm. And you're having to pay them a full-time salary and benefits and everything. Now, that's not the case with y'all. Y'all are more of a partnership and that you do with the doctors or the clinics. So can you kind of explain how this is not going to be taxing on the individual physicians or the clinics with what y'all do?
Yeah, no, Dr. Moffett, I love that question. And I'll give a little bit of history and background, and I'll directly answer that question. So we started as a healthcare law firm 28 years ago in the great state of New Jersey. And we have other facets like litigation, transactional, family law, IP. Primarily, we have been a healthcare law firm. We represent everyone but the insurance companies. We will not represent them. And in those 20 years total, in 27 years, we've recovered a total of $1.17 billion for the medical community in 3 buckets: workers' compensation, personal injury protection, and commercial insurance. We had 180 employees. We were a multiple 8-figure law firm in 10 states. Then the surprise bill law started coming. We started moving around. 2022, we created Callagy Recovery. And in 2026 alone, we will recover $1.2 billion for the medical community. Now, let me tell you why that's not interesting, and then I'll answer the question. It's because in May of 2025, we, and by we I mean Sean Callagy, who's our visionary, and Tom LaGreca, equity holder of Callagy Recovery, were asked to go to Washington by Health and Human Services. We've been asked, and by we I mean Sean Callagy has been asked to testify against Congress, which for what's known as the Enforcement Act. And I personally will be in Washington the 8th, the 9th, and the 10th to support this very, very important and incredible initiative. One of the things, Dr. Moffett, that Health and Human Services said in that meeting is that 90%, 90, of the eligible encounters, files, surgeries that could be arbitrated as of May 2025, this was 2020, 2022 when it got enacted, 90% have not been arbitrated for two reasons: lack of education and fear of insurance company retribution. That's why I'm here with you. That's why I'm so committed to working with these surgical societies, medical societies, because I want to rewrite the narrative of what's possible. So to address your question, here's our business model, everyone. I say it very simply, it's an asymmetrical risk, because the way we do business is we work on a contingent basis, which means you do not exchange money for our service. We front the filing fees because everyone, Dr. Moffett, is going to be in one of four buckets. Bucket one, they're going to be an ostrich. They're going to put their head in the sand and say, this is complicated, this is too hard, this is expensive, I'm scared, I don't want to do this. Please don't be an ostrich. Bucket number two is going to say, I'm going to hire, like you said, my best friend, my ex-girlfriend, my dog, my fraternity brother, and I'm going to hire them to do this for me, right? Nothing against that, but they work 9 to 5, and whether they help you recover $1 or $1 million, they have 2 weeks paid vacation. They're not incentivized to get you as much money as possible. The third bucket is they're going to outsource this to their billing and revenue cycle management company, which they think are experts. And no disrespect to billing and RCM companies, I love them. I do a lot of business with them. That would be like you, Dr. Moffett, coming to the great city of New York and saying, Fernando, I want to have the best pizza in town. And I say to you, I know where you should go. You should go to Olive Garden. Now, I love Olive Garden. The breadsticks are amazing. Nothing against Olive Garden. But that's not the best pizza. If you want the best pizza, you got to go to the pizza joint. Where the pizza joint, RCM and billing companies are Olive Garden. The fourth bucket is I've been on my hands and knees praying that somebody would introduce me to Callagy Recovery. Thank you, Candace. Thank you, Dr. Moffett. Thank you, Natalie. Thank you, Dr. Claude Brunson. Thank you, Dr. Hart, for introducing us to Callagy Recovery. Because the way we work is as follows. We're contingent based, and we front the cost to do this, which is about $1,000. So we front all the money, we front all the energy, we front all the time, and we only generate revenue if you generate revenue first. It's an asymmetrical risk. So I'm either the dumbest entrepreneur on planet Earth, or we've created a really holistic, transparent, and integrous value proposition where the only way we win is if you win and the insurance companies lose. So there's really no risk, Dr. Moffett, because you're either going to break even or win. You're never going to lose. And actually, in final, the biggest risk is not taking a chance with us. It's doing nothing. Because on the federal side, there's a 30-day statute of limitation. There's some nuance on the state level. So if you do not do something in 30 days, you're actually burning cash. So it makes more sense to risk it trying with us, even though there's no risk, than doing nothing at all. Back to you, Dr. Moffett.
Phenomenal. Just to kind of re-clarify, because I feel like there's some very important points there, and you can kind of correct after I re-summarize for you there. But essentially, if a ortho clinic or whoever it is comes to Callagy Recovery and institutes a relationship with y'all, which we'll kind of discuss how that process would be. But that clinic would put up no money to y'all whatsoever. They would not set up any monthly payment schedule to y'all. They would not, sign anything like, hey, if we haven't done business in 12 months, we're going to owe y'all back some money. We're going to owe you back the $1,000 you spent on the filing fee. None of those risks are there. They basically just enter into an agreement with you that is like, hey, we're going to go after this. You're going to give us access to your EOBs or whatever it may be, and we'll explain that in just a moment. We're going to shift through those ourselves. We're going to pay the filing fees. And if we collect $500,000, we'll keep this percentage of it. Y'all get the rest of it. And is that pretty much it? Is that correct?
You're hired. Yes. What you said. Absolutely. Yes.
Excellent. So on that, let's say that I am a multi-specialty clinic, who work at several different hospitals. So, maybe I'm in network at this one, but I'm not at this one, which is where a lot of this No Surprise Act stuff comes to, because maybe the hospital's in network, but the doctor who works at 3 different hospitals is not in network. So how would I kind of come about signing up with y'all, and what would y'all need from me, and what would that look like?
Beautiful. I'm going to take just a little bit. As you can tell, I like to contextualize before answering the question. And I think the best way to answer this question, Dr. Moffett, is through a story. Because one of the challenges I get is, well, I don't want the patient to be involved. I don't want bad press, There's like these innate constructed malplaced fears, and I just want to address them very quickly, and I'll share a quick story. So how does this all work? And it'll answer the question that Dr. Moffett asked, which is, how do we do business together? How do we get into a relationship? So let's say you and I, whoever's watching this, we have a friend, and his name is Johnny. And Johnny decides, for whatever reason, that he wants to be a hero, and he wants to clean the gutters on the second floor of his house. I don't know why on God's green earth he would clean his own gutters, but he was in the mood to be a hero. So he gets on a ladder, begins to clean the gutters. His wife's in the living room, his son's in the basement playing video games, and his daughter's in her room reading a book. A gust of wind comes, pushes Johnny off the ladder, hits the floor. His wife hears a big thump, looks outside the window, and starts panicking. Runs outside through pure adrenaline, is able to pick him up, shove him in the car. In that moment, Dr. Moffett and everyone, this is what John's wife is not thinking. I wonder if the hospital I'm going to take my husband to accepts my insurance. That is not what she's thinking. What she's thinking is my husband going to die, or my kid's going to have a father? So they get in the car and they go into insert hospital in your state here, and they go into the emergency room, right? John is going to get admitted. In that moment, there's going to be a general surgeon, maybe a neurosurgeon is going to get on call because he cracked his skull. Maybe an orthopedic is going to be on call because he fractured his elbow. Maybe a plastic surgeon is going to be called because he got a couple lacerations. There's going to be an anesthesiologist. There's going to be a plethora of providers that are going to help Johnny, right? For the sake of the story, let's pretend Johnny wakes up the next day. He's alive, well, his wife's to his left, his kids are to his right, and the hospital goes crazy. Now, life is good for Johnny, except 5 to 6 months later, he's going to get collectively hit with, let's call it on the low end, $100,000 balance bill. Life is no longer good for Johnny. The No Surprises Act was created, Dr. Moffett and everyone, to stop that from happening. No Surprises Act, hence no surprise bills. That's the purpose, is to protect Johnny. So now take Johnny and remove him from the equation, right? Johnny's out. Johnny's done. Johnny's chilling. Johnny never has to deal with me, the provider, an insurance company. Johnny's over here. Johnny's part of the story is over. Now let's introduce Tommy, the orthopedic surgeon, right? The member of Mississippi, or insert your state here. And Tommy was hanging out at his kid's soccer game, got a phone call. Johnny fell off the ladder. Can you please come help Tommy? So Tommy is on call, because remember, this is for out-of-network providers that are doing work in the emergency room with patients that have out-of-network commercial insurance. That's who this is for. This is not for elective surgeries. This is not for in-network surgeries. This doesn't count for Medicaid, TRICARE, or any type of CAID or CAL. This is for out-of-network commercial insurance. So in that moment, Tommy is going to support Johnny, and this is how it's going to work for Tommy. Once Tommy does what he does, whatever operation, he's going to bill Johnny's insurance as if he's in network. What the insurance companies are going to do, Dr. Moffett, is they're going to use an average QPA, an average in-network rate, which is typically 5 to 10% of the bill. So let's use easy numbers, right? Let's say Dr. Tommy bills $10,000 for whatever surgery he did. And for all my surgeons, they're like, it would be so much more. It would be so much less. This is a hypothetical example, and I'm using easy numbers, so chill with me, all right? So let's say it's $10,000. The insurance company is going to offer $1,000. That's known as an underpayment. So in that moment, Tommy's going to be one of the 4 buckets we said before. But let's say because of this podcast, I already knew Dr. Tommy. So Dr. Tommy would have a conversation like we're having today, and we would sign 2 agreements. We would sign a BAA, a business associate agreement, right? That allows us to be HIPAA compliant and review the medical records. We would sign a contingency fee agreement, which would lay out our cost and what we're doing and how we generate money. We would then say we have that all signed. From there, Dr. Moffett, we would become Dr. Tommy's, known as his IP, his initiating party. I'm happy to discuss what happens from there, but I want to make sure I check in with you. That's a pretty important part most folks are not aware of, but I believe that answers your question. We sign a BAA, we sign a CFA, then we get to work. Once we receive their EOBs, 835s, 837s, we need that to review, and we need the patient demographics and the clinical records in order to file. What does filing mean? I'm happy to answer, but I'll give you Dr. Moffett the microphone.
I'm always happy to know it's not only the medical community that uses too many abbreviations. I'm glad to know that legal and businesses do as well.
Well, that's actually not my fault. Fun fact, actually, the insurance company created all this, so you could blame them because they're the ones that made the federal IDR, EOB. I mean, that's all your fault.
Yeah, it's crazy. No, and I'm fine going over the kind of what acting as the IP means, but I kind of want to hit two things there. Is first, just as like I said, most physicians really do, they go into medicine wanting to serve people and help people. And I think that, let's kind of appreciate that bill was passed in the first place so that Johnny doesn't really have to worry about that anymore, which is excellent. We actually, Mississippi State Medical Association leadership was actually involved in getting that passed years ago. So your Mississippi State Medical Association and the AMA members that we have were actually a part of getting that passed and helped advocate for it. So I want to kind of just pause, bookmark, very glad that got done. Now, we got the patient taken care of. We got to make sure doctors are still around to take care of the patient. Because if you have enough of these unpaid bills, you might not be able to pay your staff, and then you don't exist as a physician anymore. So I kind of want to take a second before we get into more technical stuff, and we're getting out towards the end of time, to figure out our avatar for this. When I say avatar for this, so the physicians that when they're listening to this, like that's me. So I want to figure out who our best avatar is. There's going to be certain specialties. We know that ortho, neurosurgery, anesthesiology, maybe someone who goes to a few different hospitals, or maybe someone who has a private practice, a big multi-clinic with 10 orthopedic surgeons, and they kind of cover this hospital. What other things do they look at? Like high uptake of commercial insurance in the area. Like what is the avatar of a doctor in Mississippi going to look like that can benefit from this?
Beautiful. Love that question. Let's put in a couple buckets. So it is any medical provider that is doing work in an emergency room on call. It includes and is not limited to neuro, ortho, plastic, spine, OBGYN, cardiologist, podiatrist, cardiovascular, maxillofacial, hand, any anesthesia, radiology, intraoperative monitoring, anyone that's involved in the emergency room, anything that's involved that's emergent, they would qualify. Now, the patient has to be out of network and has to have commercial insurance. So if you're a medical provider that's doing work on call, dealing with emergent surgeries, and you're dealing with patients who have commercial insurance that are out of network, this qualifies for you. That's bucket one. Bucket two are known as the inadvertent providers. So what does that mean? Let's say I'm playing pickleball, I hurt my elbow, and I want to go to the best orthopedic surgeon, and I'm going to do an elective surgery. By doing an elective surgery, I'm doing a good faith estimate. There's no surprise bill. And then I tell my surgeon, hey, I'm going to pay you cash. I want to go to an in-network facility. So everything's covered, right? Except when you get to surgery, the anesthesiologist and the physician assistant happen to be out of network. That would trigger a balance bill. Those could be recoverable. The third that I'd like to talk about, Dr. Moffett, is for my in-network community, you're probably toning out and going, well, this isn't for me. And with respect, yes, it is. And listen to the precision of my words. I'm not saying you're the problem. I'm saying you may be accidentally at cause of the problem. Here's why. Because, as we all know, doctor, in-network rates have gone down, not up, for the last decade. And I highly doubt that the insurance companies are going to find Jesus and decide to give everyone a raise anytime soon. It's just not going to happen. So what does this have to do with the in-network community? Well, I am not saying that all in-network providers should go out of network. That is not what I said. Please don't misquote me. Here's what I'm saying. What I'm saying is the in-network community should take a look at their payer set, their payer mix, and see what are the top 3 providers that are screwing the carriers, that are screwing them the most, and they should consider going out of network with them. Because instead of begging the insurance company to raise your in-network rates, you now have a forum. Because what the federal IDR system did is very incredible. It took the patient out of the dispute. It gave the providers a forum where the insurance companies are not making all the decisions, and it make it economically feasible for the surgeons to make money. So for my in-network community, you should look at your carrier mix, go out of network, non-par with the ones that are paying you the worst, come arbitrate through the No Surprises Act, make a ton of money, about 8 to 12 times more than the underpayment. We're recovering 75 to 85% of bill charges. And then as you make money for a year or two, you can then decide on your own if you want to go back and negotiate your in-network rate. So it would be the out-of-network community in the emergency room, inadvertent providers, and my in-network community, maybe you should consider the strategy as well.
And I like that strategy, and you can just kind of run the numbers and see, and you're not doing anything inappropriate. You're just trying to make sure that you get reimbursed for what you actually do at an adequate rate. An important note there, kind of in summary, is do any of your work on call? This could probably qualify for you. Maybe some anesthesia stuff if it's not an emergent surgery, but if you were kind of stuck in between an in-network hospital and an elective orthopedic surgeon negotiated a thing, potentially work for you there. Now, kind of to understand, what if you're a doctor in rural Mississippi and you do some procedures and you're like, well, this doesn't apply to me because 90% of my population is Medicaid or Medicare. How many patients per month might make this worthwhile? It probably is not very many, I would assume. One.
And here's a very simple math. The insurance companies on the 90% of the files that are ineligible that aren't being passed through, that equates to $500 billion a year that the insurance companies are stealing from the medical community. So if you can get back a penny, why would you want the insurance company to keep it? And it's not a penny. It's definitely more than a penny. It's like 5 figures worth of pennies. So if it's just one case a month, you would be shocked at how economically important and impactful that could be, because the in-network rates are so low that one out-of-network case could, in certain ways, in a very extreme scenario, generate more revenue than dozens of in-network cases in the right scenario. And we do not discriminate whether it's 1 or 100 a month. We don't care. We're happy to help. We're advocates. We're leaders. We want to support the medical community. So if you're doing 1 a month, if you're doing 1 a quarter, if you're doing 1 a year, we'd love to have a conversation with you.
And that's awesome. I kind of agree with you on principle of the matter. If I'm not having to do much work myself and y'all are doing it, I'd rather just go after all of them. So Dr. Hart, I know you have a medical background yourself some, and I know you've talked to a lot of associations. Kind of anything you want to add here that you felt has been really important to the medical community, or physicians or patients, anything you want to add on?
Yeah, so one thing in specific is in relation to the in-network providers, right? Like as Fernando was mentioning, we could easily say this doesn't matter, it doesn't apply. But Dr. Moffett, would you agree that there's a lot of variances between all the different insurance carriers?
Absolutely.
So just because you're in network with Blue Cross in Mississippi doesn't mean you're in network with Blue Cross in New Jersey, Tennessee, Texas, all the things. So even if you think that this doesn't impact you much, there's also no risk for us to take a look. We'll provide a 30-day complimentary review of the EOBs for all claims you have, and then we can qualify which ones would have qualified, be able to back into a potential dollar amount that we think you could have recovered. As Fernando mentioned, the biggest risk is doing nothing at all, and the only people that win by that happening are the carriers itself. And I don't know about you, Dr. Moffett, but if we take a small chunk out of that $500 billion a year that's staying in the carriers, I think that's a win. Let's not take a small chunk, let's take a large chunk. And in order to do that, we need to do it with partners like you guys.
And on that note, I mean, just so excited that MSMA will be partnering with y'all. So if any physicians listening would like more information about how to reach out to Fernando or Brian or Callagy Recovery, please contact MSMA. We have all their information. We'll probably have some of it posted in some of the show notes here as well. Just very, very excited that physicians are going to have another way of potentially getting back some of that reimbursement. They've already done the work for it. They've already been on call. They've already helped the patient. Just getting some of that money back that they already earned and deserve. So
thankful that Mississippi started this journey for us technically in June of 2025, and a lot has happened, and a lot will happen with the impact that we can create because of the choice that Mississippi State Medical Association said to say yes to us, so we can support you, your members, and which turned into the community as a whole in terms of associations everywhere because of Mississippi setting the stand. So we wanted to thank you guys and know that we do not take this responsibility lightly. It's something that I think about a lot, and it's our duty, Fernando's, mine, and the rest of the team at Callagy Recovery, to drive this initiative forward to places beyond we thought possible. And it all starts with 1 group, 2 groups, 3 groups, and starts with you guys.
Please come to some of our Mississippi State medical events. We've got See Me in the Sand next year. We've got annual session in August. See Me in the Sand, I think, will be in May. Just look on the website. You can find all of our events. You may even see some representatives from Callagy Recovery there potentially every so often. Very happy to be here with you. We will have probably a second part of the series most likely coming, where we're hopefully going to try and talk to some doctors that have been affected by these processes of the No Surprise Act and kind of see how that's affected them and see how they could have benefited from Callagy Recovery. Very excited to be here with y'all today. Until next time, thank you.
Thanks for joining us on Call with MSMA. If you're a physician in Mississippi, you're part of something bigger, a community of over 5,000 doctors dedicated to improving care and protecting the future of medicine in our state. To learn more, visit msmaonline.com. And don't forget to subscribe for more conversations about the business, the challenges, and the future of medicine here on Call with MSMA.